Is that good enough? Or can I sit up?
About 2 minutes out.
Okay.
How is everybody? Hey, Dave McKinney. Nice to see you.
Mary Ann, how are you? Thank you for asking our questions.
Yes.
Thanks. Oh my gosh, I have gotten such a wild response.
Good evening and welcome to the Week in Review. I'm Brandis Friedman in our Northwest Side studios.
And I'm Paris Schutz coming to you from my home in Lakeview because of the coronavirus pandemic. We'll have our full Week in Review panel in just a minute. But first, Brandis, back to you for some of the latest developments from today.
Thanks, Paris. Chicagoans will get back to some sort of normalcy, but Mayor Lori Lightfoot isn't putting a date on when just yet. Lightfoot is, though, sharing her framework for the circumstances under which the city could reopen.
We must never confuse promising gains with outright success. We are not at the point where we can begin reopening our city yet. The light at the end of the tunnel is absolutely there, but it's still just a glimmer, and we still have a long way to go before we can safely return to the way things were before.
The plan, which closely aligns with the governor's, says the city is already in phase 2 of her 5-phase plan, where the city is still working to flatten the curve. Phase 3 will allow a cautious reopening with non-essential workers phasing back into work, but masks and social distancing would still be required. The same goes for phase 4, but more public amenities return and fewer restrictions on businesses. Phase 5, all businesses are back open and some events can resume. Meanwhile, the state says it has passed a testing milestone, hitting more than 20,000 tests in the last 24 hours. The Illinois Department of Public Health says 130 people have died in that time, bringing the state's total to more than 3,200 deaths. More than 2,800 additional positive cases were diagnosed for a total of more than 73,000 statewide. Now, despite those numbers, State Public Health Director Dr. Ngozi Ezike says looking at average number of deaths per week, she believes the state hit its peak of deaths 1 or 2 weeks ago.
I don't think overall this is one of our heaviest weeks, even though there may have been a cluster of deaths that were reported that seem high in 4 days in a row. But if you maybe take the aggregate and look at weeks, I don't think this week has been worse than last week.
And neighbors in Auburn Gresham received some access to that testing for COVID-19 today. But community activists say more work needs to be done. Following up on a story we brought you a couple of weeks ago when Paris was reporting in the Auburn Gresham community, he and his crew heard this recurring theme.
We need a testing site here in Auburn Gresham. It's number 31 out of every zip code in the state.
And the fact that we don't have a testing site in the community that has such a high number of cases is shameful.
Today, Howard Brown Health partnered with Mobile Care Chicago to provide pop-up COVID-19 testing in a church parking lot where they tested 111 people over several hours. The van will be traveling to other communities next week as well. The Greater Auburn Gresham Development Corporation says it is working with other partners in the area to set up a semi-permanent testing site within the next 2 weeks. And I'll be back in a bit, of course, to fill you in on what we have in store for you next week on Chicago Tonight. But for now, on with the Week in Review. Hey, Paris.
Hey, Brandis, thank you. And as I mentioned earlier, I'm coming at you from my home in Lakeview, and our guests are joining us via video conferencing technology all over the area. And they are Craig Delamore of WBBM News Radio, Dave McKinney of WBEZ, Carlos Ballesteros of the Chicago Sun-Times, and Ann Ahern of NBC5 News. Thank you all so much for being here. Let's jump right into it. Ann, today's numbers: 130 deaths, 2,900 new cases, 20,000 daily tests. You heard Dr. Ezeki saying perhaps the peak was about a week ago. So are we on the downslope of this curve, or is it just leveling off right now?
It seems as if we've hit this plateau, and I'm not a scientist, but are we going to be on this plateau for a while, and it's going to take some time before we actually see this decline that we're really anticipating?
And Craig Delamore, 20,000 tests today, a new landmark. Explain how the state's been able to finally ramp up its testing.
Well, I think what they're getting is help from a number of the private organizations and labs that have also been joining this. This is really, they like to say all hands on deck. It's really had to be because the supplies were not coming in from the federal government, but they're getting more help from the feds. I think they're probably, if they're doing more testing, they're probably finally getting the swabs that they needed, which was an essential tool in actually doing the test. So it's just a matter of finally getting the equipment and the wherewithal to do the testing that they've wanted to do all along, and also getting a rhythm.
And Dave McKinney, the governor, announced this week a 5-stage reopen plan. He divides the state into different regions so they can reopen at different times. Apparently, Chicago, Cook County, this region is in stage 2. What does it take to get to stage 3?
Well, I mean, there are a number of criteria. I mean, one of them is that these regions have to show 28 days of level or declining hospital admissions related to COVID. I mean, that's kind of a big deal, and that was sort of a flashpoint, I guess you could say, with some of the critics here, because 28 days is a long time, and I know you're going to talk about Mayor Lightfoot's plan, but that's twice as long as what she's having. So, he was under pressure to come up with a plan. Downstate especially thought that they should be allowed to kind of reopen a little more quickly than we do here. So, this is what he produced, and we'll see how it works.
And 28 days is a long time, a full month. Does that mean we're not going to see restaurants reopening in any capacity for several months?
Well, if you look at the governor's plan, no, we're going to be waiting a while. And that's why the Restaurant Association has been speaking up and saying, how about 25% capacity? The governor, of course, today said, no way, I don't agree with that. Sam Toya, the Illinois Restaurant Association spokesman, he was with the mayor today, which gave me some thinking that he's lobbying hard. He wasn't with the governor when the governor announced his plan, but he was standing with the mayor. Perhaps she's listening just a bit to how they could maybe tweak that plan for restaurants somehow.
And Carlos Ballesteros, I know you've reported a lot on the cases in the Hispanic Latino community, but the mayor also today put forth her reopen plan. How does that differ from the state's plan?
Well, I think the Chicago area obviously is the most infected in the state. We have the most cases out of any other place in the state. And it makes sense, we have the most people. But at the same time, the city of Chicago is the economic engine of the state of Illinois. So I imagine that the mayor's considerations are trying to find a middle ground between keeping people safe and getting people back to work and the city running again.
And Craig Delamore, does that mean that parks, the lakefront trail could reopen before, we get to stage 5 of this?
It could, but one of the factors that the mayor really had to talk about was that people themselves were not listening to the guidance that would have allowed the lakefront to stay open when it was open. They were crowding, and she said that if that happens again, they would have to shut it down. So she wants to get into a position where, and this would be, it's a possibility, maybe along stage 3, which is the next stage for Chicago. We are supposedly in stage 2 right now. But it has to be when she sees that people are able to stay apart from each other.
Dave McKinney, why, the governor did divide the state into different regions, so downstate, western Illinois, central Illinois could open at different rates based on their hospitalizations. What is it that GOP and downstate lawmakers want?
Well, I mean, I think that there's a growing level of frustration that the governor's use of his emergency powers through all of these executive orders he's done, I mean, there are like more than 20 of them so far. I think they're sort of feeling left out. They don't feel as if they are having any seat at the table to try to influence what some of these rules are and guidelines. So we heard House Republican leader Jim Durkin, for example, and some of his members saying, bring the legislature back somehow. Let's start talking about this as a group. And so the Republican pushback is really around that. They don't like being left out of these discussions. And I do think that they see serious economic harm that is just, it's everywhere. And Durkin did talk about the restaurants as well. And it's, I think that the Republicans feel like this is an issue that they can make some hay with, but it's a very difficult thing because, nobody has the answer. That's the bottom line here. Nobody has a timeline about when it is we're going to be advancing from one stage to the next. And, who knows?
Paris, can I add, the state has 11 health regions. The governor has divided them now just into 4. So perhaps there would never be happiness what region you're grouped with, but there are some who are saying, wait a second, even, who wants to be grouped with Chicago? Probably not the suburbs, but they are. So it is, rather than doing 11 separate orders, which probably would get very confusing, he has decided to do these 4 bigger divisions. It still might bring some changes in that. Will schools start in one region, and that means high school sports as well and extracurriculars, but another region might not? As Dave said, we're just in such uncharted territory. It's hard to know what is the right thing.
And Craig Dellamore, the Bears put out their schedule yesterday. Does the governor think that there will be an NFL season, at least in Chicago?
The governor now, unfortunately, the mayors and the governor's news conferences kind of butted up against each other, and I was focused on the mayors. But I do know that, he has his doubts that we will see anything going on at Soldier Field. Interestingly, Mayor Lightfoot has said she can envision teams playing in the baseball stadiums sometime this summer, but probably not with crowds.
Interesting. That's going to be an interesting dynamic. Carlos Ballesteros, so the mayor and the governor this week are acknowledging the fact that the number one impacted group is a Hispanic Latino community. I mean, we've seen, we've seen the preconditions in these communities for many, many weeks. Is it just a matter of testing now is catching up in some of these communities and we're seeing more numbers of cases?
I think so, and just to be clear, Latinos make up only 17% of the state's population, but are now 26% of all confirmed cases. And like you mentioned, that might be an undercount because, as reported by Maria Zamudio at BZ earlier this week, the top 5 zip codes with the most infections are predominantly Latino areas, like Little Village and Belmont Cragen, but they're also some of the least tested areas. So the numbers might actually be much worse than we know now. There's also a question of Latinos being overrepresented in so-called essential jobs, which means that they can't stay at home and work. And so they're having to choose between risk becoming infected or paying their rent. And that's a difficult choice that a lot of people make.
And so the lack of testing has been an issue in a lot of communities. We heard Auburn, Gresham, which is predominantly African-American. They're getting a one-day pop-up testing site. They've been clamoring for testing. Is there any signs that there are going to be more state-backed or city-backed testing facilities in some of these underserved areas?
It's unclear. I think the funding from the federal government has basically withered away. There are more testing sites at community health centers, which are predominantly located in Black and Latino communities in the city. But it's an uphill battle. And these test sites, maybe if they would have been up 2 months ago, we would have had a better picture of what's going on. But 2 months into the pandemic, and we still don't really know how high the infection rate is in some of these communities. And that's a problem.
All right, let's move on to some other news this week. A strike by workers at 64 Illinois long-term care facilities is averted as nursing homes account for 44% of the state's COVID deaths. The state's overhauled unemployment system is adding 100 more workers to handle more than 1 million people trying to file for benefits. And the governor condemns racial profiling of a lawmaker who was stopped for shopping masked while black. Dave McKinney, is the state getting the situation at nursing homes under control at all?
You know what? They're trying to. I mean, they're dispatching crews from the Department of Public Health to the hot spots. But, you know, it's really kind of a multi-pronged problem here. I mean, you think about nursing home folks. Many of them they're probably, there's nobody else at higher risk than these people are, because many of them have underlying health conditions, of course, and then they're all kind of housed on top of one another. And so there's just, early on, there wasn't proper testing, so the staff could be coming in and bringing stuff in. So this is where the big problem is at, and they are aware of it. They've begun reporting, over the last couple of weeks, giving more details and data about the nursing homes, which I think is essential. So, the public knows where these hotspots are. I mean, I kept thinking about, the reporting we did at WBEZ on the Quincy Legionnaires stuff. I mean, it's a different disease, but a similar problem here, where families were not being kept up to speed about what was going on within the four walls where their loved ones were at. So that's a problem here for the state that they're trying to rectify.
And if I can jump in
go ahead, Craig.
I was going to say, the other problem that you have to deal with nursing homes is that it's not a monolithic system. You do have some that are more under the guidance of the state, but these are a lot of private homes too. And one of the things that we heard from the employees who were protesting what was going on and threatening to strike was that you could find completely different rules from one home to the other. And, in one home, someone said that they were told that they could wear plastic bags to use to guard against the virus. The mask policies differ from place to place. So that's one of the things that had the anxiety level so high among the employees.
And Mary Ann, how were these nursing homes able to avert a strike? I mean, SEIU, the union that represents a lot of these workers, were saying, the conditions are not good. We're threatening to walk off the job. How did they fix that?
I know. I wish I had the details in front of me. I'd written them down earlier, and I had such a crazy day as being the pool reporter today, so I don't have it right there. But I know that they, of course, had wanted a pay increase. And, this is the time. The timing was right for them. And that's when you have to strike and that's the wrong word, of course. You have to go after what you're looking for and say, hey, you need us.
Who said never let a crisis go to waste?
Exactly. And if I could also add on those nursing homes, the McCormick Place alternate care facility, while they had plans and had hired staff and brought on a lot of folks, they have sent many of those nurses, physician assistants, and others that they have hired because they gave them an 8-week contract. So they have sent them out to various long-term care facilities around the state to help out. And of course, more testing going on as well.
I could add one more thing about the nursing homes. Yeah, another issue is obviously, as was mentioned earlier by Craig, there's also an issue of, very rich nursing homes and very poor ones, and the ones that are public housing as well. I know for a fact that, for example, at the George Collins Apartments on the Near West Side today, earlier this week, I reported one resident said that no staff had masks, that the company that manages the building hadn't handed out masks to anyone, any residents or staff, gloves, a lack of cleaning supplies. So all of these different factors, all these inequities that present issues on a regular basis pre-pandemic are now becoming so dire and extreme.
And nursing home ownership is always a tricky thing to investigate and look into, because sometimes you don't really even know who the owners are. They could be conglomerations, they could be hedge funds. It's impossible to know. Dave McKinney, has the state fixed the glitches in its unemployment system to handle the demand now, the historic demand that it's seeing?
I wish I could say that was the case, but I mean, it's still really hard to get through to a person on the phone. It's still hard to access their website and file the material you need to file. And it's a real soft spot for the Pritzker administration now, and they realize that. So they've been putting a lot of resources, spending a lot of money, millions of dollars, in contracting with people to come in and man the phones. They've talked about bringing in, I think, 100 more people to answer phone calls this coming Monday, and it's money that I think the federal government will potentially provide the state, but the state is spending money it doesn't have to fix problems like this. And I would say the unemployment security issue is one of the greatest. When we see, 1 million people in the state of Illinois out of work, it's something we haven't seen before. And so the Pritzker administration is on it, but it's still lots and lots of work left to be done.
It
still
is interesting.
very frustrating, I know.
Yeah.
Go ahead, Marianne.
It took them so long. I mean, here we are, what, eight weeks in, and those are the main questions that we just keep getting over and over again, of people so frustrated. And they kept promising, oh, just wait till it's your date, or because of your last name, or keep calling, go online. And none of that was working. Well, I shouldn't say none. A few people obviously were getting through, but to now hire these folks 8 weeks in, glad they're doing it. But as Dave said, this is a definite soft spot that they need to make sure next week, when the freelancers, the gig workers, the independent contractors can finally file, let's hope they get some answers.
Yeah, we've all heard stories of folks having trouble getting through. Yep, go ahead, Carlos.
Sorry about that, Paris. I also wanted to mention that with the issue with the unemployment insurance that I want to highlight is that there are around 400,000 undocumented people in the state of Illinois, and none of them qualify for unemployment insurance. And many of them depended on daily wages to survive pre-pandemic. And they also didn't receive a stimulus check from the government. Neither did people who filed taxes jointly with an undocumented spouse, even though they're a citizen. So, people out of work, not only can people access the system, but also people who need it can't access it, legally.
It's certainly a tricky situation, and I know that private foundations and social service agencies have tried to raise money to offset some of those costs for undocumented workers. Craig Dellamore, there's still this issue of a state budget that's going to be wildly out of whack. It has to be passed by the end of this month, and there's no sign that lawmakers are even close to getting together. So how does this end?
Well, I think what especially the Republicans in the legislature fear is that it's going to end by someone, or the Speaker and the Senate President, finally agreeing to what they will say is a safe way to meet. And the Senate Republican leader Bill Brady says there are already models for that because other legislatures are meeting, but they will meet and maybe have a day or two to go over the budget plan that is put forth by the governor and basically rammed through by the Democrats. And I think they're worried that they're going to get maybe 3 days. Yeah. Yes, but it'll probably be even faster.
Right. Dave McKinney, you've covered so many of these late night, last minute budget sessions. Do the same rules apply here? If they don't pass something by the end of the month, they're going to go into overtime and they're going to need a supermajority to pass what's going to be an incredibly difficult budget.
Incredibly difficult. I mean, they might struggle to get their majority caucuses all in place. I mean, people, if they have health problems or spouses with health problems, they might not be there. So the Republicans are in position here, especially if they go into June, where their votes will matter. And so, I think that the Democrats are trying to figure this out. And, the public health department, the state public health department, put out some guidelines to the legislative leaders to help them kind of navigate this. And, it's going to be one of those things where people are having their temperatures taken at the door of the Capitol, if that's where they meet. And then there was one provision in there that I thought was kind of funny, not funny, but unconventional, where, staff people would be the ones casting votes for some of these people who couldn't be on the floor safely. It's just a mess. And under the law and under rules, they don't have the ability to meet virtually. They can't cast votes from their living rooms or dining room tables like we're talking now. So they all have to be in place. So it's created a nightmare situation for them.
But Bill Brady did say, I was just going to say quickly,
ahead,
Bill
Greg.
Brady said something that they have done before is that they could meet in, say, the Capitol Convention Center, which would allow them to spread out. They are allowed to meet in a different place. They met in the old state Capitol once before. So they could do that and manage to get it done safely.
Bill Brady, of course, the Senate Republican leader. Mary Ann, all eyes on Speaker Madigan. He sent out a press release this week saying he's in no hurry to get everyone back together, even if they can meet it in a convention center or something. So why is that?
He must think, Paris, that he has the votes, whether it's May 31st or June 30th. Although he is setting the bar pretty high for himself, and I don't see some big, that the pandemic is going to all of a sudden vanish by June 30th. So they're going to be in the same issues. Why don't they figure this out to get at least a trial, get on down there and see how they're going to work it out.
I think the other issue is they don't know how much money they hope to get from the federal government. I mean, they want to get as much as they can. Is that holding up the budget process too?
I would think, yeah, of course. And they don't like the word bailout. No one wants to hear that. Of course, the Democrats don't. But yes, they're so dependent on whether or not, how much is going to be with all this money that's been spent, whether it's McCormick Place or the employment office.
All right, we have to end it there. I want to thank everybody so much. It always goes by too quickly, but we loved having you. Have a great weekend, and my thanks to Craig Dellamore, Dave McKinney, Carlos Ballesteros, and Mary Ann Ahern. And now, Brandis, we go back to you.
That time does fly, Paris. Thank you, and have a good weekend. And that is our show for this Friday night. Don't forget, you can get Chicago Tonight and the Week in Review streamed on Facebook, YouTube, and our website, WTTW.com/news. And of course, join us next week live at 7. Senator Dick Durbin on the federal government's reaction to COVID-19. And if you're looking for your next read during quarantine, some local bibliophiles offer up some suggestions. Now for Paris Schutz and the rest of us here at Chicago Tonight, the Week in Review, I'm Brandis Friedman. Thank you for watching. Stay healthy and stay safe, and have a good night.
Closed captioning is made